and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about the ability of a wound to heal. So our healable, our maintenance, and non-healing wounds. But first, if you could please hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So each wound can be categorized into 3 different types of categories, either our healable, our maintenance, and our non-healing wounds. So our healable wounds are wounds that have the ability to heal. So they can heal and the patient is adhering to the optimal plan of care. Okay, so everything should be working for a healable wound. Our maintenance wound. So maintenance wounds are wounds that have the ability to heal, but there are outside factors causing it to either not heal or heal very slowly. So this can be caused by either comorbidities, non-optimal healing conditions, or lifestyle. Next, we have our non-healing wounds. Okay, so our non-healing wounds, these are wounds that are absolutely unable to heal due to either comorbidities, either systematic disease, poor circulation, or cancer. So whatever category your wound falls into is going to determine the course of treatment. So I've just added this chart here. So it has our 3 different types of healing. So it's either healable, maintenance, or non-healing. So our wound prognosis. So treat the cause. Healable, we're able to treat the cause. The blood supply is adequate, and our coexisting medical conditions or medications are not preventing healing. So that's for our healable. So there's no reason why it doesn't heal. Our maintenance, once again, our maintenance is a wound that is able to heal, but something is preventing it from healing or making it heal very, very slowly. So are we able to treat the cause in our maintenance? No. Our blood supply for a maintenance wound is adequate, okay? But then we have either a coexisting medical condition or medications, and this can also, we can also add in adherence to our plan of care in this category here. So this may or may not be preventing healing. Okay, so there's something with a maintenance wound that is preventing it from healing properly. And our non-healable wounds. So can we treat the cause? No. Our blood supply, it's often inadequate. That's normally the reason why we have a non-healable wound, is because there's not a good blood supply. And there could also be medical conditions or medications that are inhibiting the healing process. So this is for our healable wounds. So for our healable wounds, the first thing we want to do is treat the cause. So whatever is causing the wound, we want to treat that cause. Because if you're not treating the cause, say you have a pressure injury and you're not treating the cause, so removing that pressure, the wound will never heal. So then we're going to develop an individualized plan of care. You're going to address any patient concerns, so either pain, ADLs, smoking, access to care, finances, ability to shower. So we want to address any patient concerns. If we're doing this correctly, then they should adhere to the plan of care. Okay, that's where that comes in. We need to provide education. This also increases adherence to the plan of care. For our healable wounds, we use gentle cleansers. So these are cleansers that have low tissue toxicity. So this is our saline, our water, our acetic acid, which is vinegar. So that's a 5 to 1% dilution. So normally vinegar comes in a 5% dilution. So just make sure that you are diluting that. I do have another video that I can just link below for the acetic acid if you want to know how to get those different percentages. Next, we need to debride the wounds. So with healable wounds, we can debride them because they can heal. So we can either use sharps, autolytic, mechanical, enzymatic, or biological debridement. Once again, all the debridement methods I go over in a different video, which is linked below also. And then we're going to assess and treat any superficial or deep spreading infections using our nerds and stonies. Once again, for nerds and stonies, if you're not sure what that is, another link below, just to how to assess and treat infections. And then we're going to select a dressing to match the wound characteristics. Okay, so if we have a low amount of exudate, we want to treat it with a cover dressing that is only going to absorb a little bit of exudate, because we want to have that moisture management, moisture balance in a wound. So we don't want to be putting something on there super absorbent that's just sucking everything out of the wound and making it really dry. And then our evaluation. So we are always measuring our wounds to make sure that they are getting smaller. So at the 4-week mark, they should be 30% smaller and closed by the 12-week mark. And then if we need to use any active wound therapies, skin graft, biological agents, we can do that too for our healable wounds. Okay, so on this slide, we're still working with our healable wounds. Okay, so I did add the wound paradigm just because sometimes it shows a different outline and it's a little bit easier to read instead of all those steps. This gives you exactly what you should be doing. So even though it's a healable wound, it can still be a chronic wound. So it can just be possibly stuck in one of the wound healing stages. So it's not healing as quickly as it should. But that could just be because infection or inflammation, biofilms, it just completely depends. But healable wounds, we can treat the cause. So we treat the cause, our local wound, and our patient-centered concerns. So our local wound goes into, do we need to debride? Do we need to treat infection or inflammation? So this is going through our nerds and stonies and moisture balance. Okay, so those are the steps. It's just a quick view of how to treat a healable wound. So next we have our maintenance and non-healing wounds. So I do have here a different wound paradigm. So this wound paradigm is specifically for maintenance and non-healing wounds, okay? So for whatever reason it is that these wounds are either going to be super slow to heal or not heal at all, we're unable to treat the cause, okay? We're not able to treat the cause. Our patient-centered concerns, still very, very important because we need to be making sure that any of their concerns are met, whether it's pain, their ability to shower. Heck, I had a patient one time, he had bowling on Thursdays and he wanted to have a bandage that was freely movable, didn't slide down, because his bandage normally stayed no problem until he went bowling, and then the gauze was slipping. And he just wanted something that looked a little bit more discreet for that time so people weren't really asking questions. So that was a concern for him. We did things, we used a different bandage. It wasn't practical to use this bandage because it would have to be changed way too much, but it was practical for that Thursday where he went bowling, and he adhered to the plan of care for the rest of the week because he knew that, hey, I can put this on Thursday, but when I come home, I'll just go back to my other dressing, and it was acceptable to him. So you have to find things that are acceptable for your patients, especially with maintenance and non-healing wounds. These are long-term wounds. They're not healing like they should, or they'll never heal. So we need to be doing things that definitely focus on their concerns. You'll have much better adherence to the plan of care. Now with debridement here, this is conservative debridement. So devitalized tissue only. So tissue that is no longer vitalized. So no veins, just kind of dead tissue we can remove. Now, if there's that hard eschar, that black, that scab over top the wound, we are not removing this on maintenance or healing wounds or non-healable wounds, because that is protecting the patient from getting an infection. So we leave that there. So when we talk about debridement, it's more our sloughy material that we want to remove, because it's just going to harbor bacteria and create a nasty infection. So we do need to conservatively debride that slough to get that off of there. But we also have to be cautious, because if we are using major debridement and cleaning that wound right out, if we make that wound any larger, it is not going to heal. It's not going to get smaller. So over time, if we need to keep removing and removing and removing all this slough, it's going to get bigger and bigger and bigger. So we have to use very, very conservative debridement and be very, very cautious with these wounds. So bacteria reduction is one of our number one priorities, because we don't want infection. This is going to be long term. We can't have somebody on antimicrobials or antibiotics all the time. Okay, so we want to use products that will reduce that bacterial burden in the wound. Okay, and that kind of goes along with our moisture reduction, because the less bacteria we have, the lower amount of moisture is coming out of that wound. Okay, if we have a high amount of bacteria, we're going to get a lot more drainage coming out of that wound. So we're going to be using our chlorhexidine, our povidone iodine, our acetic acid to theoretically reduce the bacteria. In turn, it's reducing the moisture. So we're also going to use our kind of thicker dressings to make sure that we don't have a whole lot of drainage in the wound. And your edges, the treatment of edges, we are not doing that in maintenance and non-healing wounds. So it's not indicated. We are not going to touch the edges of the wound, because if we start messing with that, debriding it, trying to get them good, it's going to make the wound larger. And once again, these wounds are not going to heal properly. So it's just going to continually get larger. So that's all I have for this video. I hope you did find it helpful to learn about how to categorize between a healable, maintenance, and non-healing wound, and how to actually treat it. So I hope that did and is helpful in your daily practice. And if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated. And I will catch you guys in my next video. See ya.